Hi there, Mark Jamin here, Medical Director for the Haywood County Health Department, and let's talk about where we are right now in this pandemic. Time for the weekly update. And it's time to bring back something from the early days of the pandemic. You might recall the need then to bend the curve, talked about keeping the cases down so we don't overwhelm our healthcare system. Well, its time has come once again. And the summary is, please be careful right now. Whether you have COVID or have had it or you don't, the healthcare system in Western North Carolina is stretched. So please share this with everyone you care about. Across the United States, note the red is still increasing in the south and now filling in across the west. And also notice the Northeast and the upper Midwest now turning orange and following suit. There are 3 states now over 100 new cases daily average per 100,000 population. Louisiana, Mississippi, and Florida topping the list at 170 new daily cases per 100,000 population average. For our neighbors, each with very few counties not in the red, and substantial increases in their numbers even from last week. North Carolina, the upward acceleration shows no sign of peaking. Cases continue at a steep incline. And for reference, 4 weeks ago, we were seeing just under 300 new cases a week in North Carolina. 300 new cases a day in North Carolina. This week, it's over 5,000. Hospitalizations now going up too. Notice no counties in the green or yellow now, and only 9 counties not in the red. Western North Carolina, all the counties deep in the red zone. Macon has now caught up to its neighbors. Cherokee, the highest rate in the state this week. And take note of the sheer number of new cases, especially in the more populous counties. And these across-the-board increases are on top of now 4 weeks of substantial weekly increases. Testing also indicates the rapid acceleration. North Carolina and most of western North Carolina above 10%. And especially note Macon and Cherokee nearing 20% test positivity rates. And to remind you, rates greater than 10% also indicate not enough people are being tested, suggesting the numbers we see are actually lower than what is actually out there. Haywood County ended the week at 5,025 cases total for the pandemic. That's an increase of 196 new cases over the previous week. And you can see both curves here demonstrating the exponential spread we are now in. And if you go back over the weeks, the last few weeks, our week-over-week increases have been accelerating. There was 1 additional death reported this week in Haywood County, now at 104. And Haywood Regional Medical Center, COVID-related admissions got to a high of 19 with 4 in the ICU at week's end, and up to 23 apparently over this weekend. And for reference, the peak last winter was around 27 COVID-related admissions. So everyone, please take note. Hospital systems in Western North Carolina are at their limit. Everyone's full, holding admissions in the ER. EMS is stretched beyond their capacity. They may not be able to be timely in answering your 911 call, regardless of what that call is, because they're having to wait to unload patients at hospitals who have no place to put them. This past week, for instance, there was a person with a time-sensitive, life-threatening issue had to be taken by ground all the way to Chapel Hill because that was the nearest place that could take care of them. It is just not possible also for counties to share their resources, where one hard-hit place helps out another less affected place, because right now, every place is being hit hard. And when asked how this feels compared to last winter, the response I got was, it feels worse. And we've not reached the peak yet. It no longer matters what you want to believe about where the pandemic came from, what you think is going on, or whose numbers you want to believe or not believe, or who you want to believe or not believe. Whether infected or not, every one of us is now being directly impacted, and there is only one way to get past this. Avoid being in close contact with anyone. Isolate as soon as you develop any symptoms. Delta, by the way, is much more like your usual cold or sinus symptoms. And quarantine if you were a close contact to someone who gets infected. Whether you like Swiss cheese or not, now is the time to develop a taste for it. Don't give the virus the next someone to jump to. And don't help the virus out. Avoid being a close contact. Avoid crowds. And if you must go into one, wear a face covering. Limit your time around any one person. Keep your distance and get vaccinated. This has accelerated so quickly it's caught all of us by surprise. And be careful you don't get injured right now. And if you have a chronic condition, be extra careful. Whether you have COVID or not, you will be affected and possibly suffer because the healthcare you are accustomed to having immediate access to is just not there in that way right now. So be well and please be careful, super careful, especially right now. My buddy is, because there's no sign yet that we've reached the peak.